are taken from little quantity to subside or treat or cure illness or sickness. Then we have examples of drugs which we all know. Cocaine, marijuana or marijuana, etc. Then medicine. Medicine can be defined as a chemical substance that is used in treating patients. Examples of medicine. We have paracetamol, then sources of drugs. Drugs, we have so many sources of drugs. Drugs can be gotten from plants. Drugs can be gotten from natural or mineral resources and some chemicalized environment, etc.
Thank you. Thank you. Yeah, sit down. Thank you. Encourage him. Your number is what? 7 what? 769. All right, I am. Start from here. Face of medicine. Come on, Jesse. Morning.
Face of medicine under the following: absorption, distribution, receptor and finity, metabolism and excretion. Absorption is referred to the movement of drug from each site of administration to the bloodstream. It occurs after a substance is administered, but there are several different methods in which someone can use or abuse the substance that will affect how the drug is absorbed. The various routes of drug administration include oral administration. This includes swallowing pills, drinking a liquid, or eating a substance. In this method of administration, most of the absorption of the substance takes place in the small intestine. The drug will then move to the liver and then back into the bloodstream to be transported to its destination. The liver and intestinal walls metabolize many drugs, lessening how much it gets to the bloodstream. A process called the first pass effect or first pass metabolism, because drugs delivered to the road, such as injections, don't go through first metabolism. It may only take a lower dose than the oral dose to achieve the intended effect. This is why a doctor who is injecting a prescription may administer a lower dose than injection. In distribution is referred to the process of the drug moving into and out of the tissues of the body. The volume of distribution relates the concentration of the drug in the plasma to the total.
The time is up. Thank you.
Difference between drugs and medicine.
You can't get more. I continue.
Drugs, they are chemical substances which, when administered to a microorganism, will have a biological effect in them. Then, while medicine is also a chemical substance used for treatment and diagnosis of different diseases and illnesses. Then we have the sources of drugs. We have the plant, the animal source, mineral source, microbial source, semi-synthetic source, and recombinant sources.
How many are they?
Yeah.
How many sources? Call them again.
The plant source, animal source, mineral source, microbial source, semi-synthetic source, and recombinant drug source.
Okay, continue.
Then, for the plant source, in most instances, these medicine substances are derived from animal body secretion, fluid or gland, insulin, heparin.
Which source are you talking about?
Animal
Okay.
source, thyroxine, cod liver oil, malt, etc. In this sort of drugs, and we can get, for example, we have the cod liver oil gotten from fish. Yes, and I've forgotten the name of the medicine that is used for. The plant source, it is the most plethoric source of drugs. Almost 90% of drugs are obtained from different parts of the plant. Drugs can be obtained from every part of the plant. Here, in the olden days, most of the plants are used to cure illnesses or diseases, or even maybe bites from dangerous animals like the snake. And if you have overflow of, when you are injured and your blood is gushing out too much, you can use the normal onugbu leaf you use to subside it. Then the mineral source. Drugs from mineral sources include both metallic and non-metallic substances like kaolin, chalk, diatomite, ECC, and minimal minerals or their salts are useful. This one.
Which one?
The mineral salts.
Talk now. You have to listen. You have less than 1 minute to go.
Semi-synthetic source. When the nucleus of drugs obtained from natural sources is retained, but the chemical structure is altered, we call it semi-synthetic. This part of source of drugs, they are gotten from natural resources, but then they are now taken to industries to be.
Thank you.
The nucleus of drugs.
What are you talking about now?
Synthetic.
Semi what?
Synthetic.
Sort of what?
Of drugs.
All right, continue.
When the nucleus of drugs obtained from natural sources is retained, but the chemical structure is altered, we call it semi-synthetic drug source.
Okay, good. I like that point.
Then we come to the recombinant drug source. We say that it was the first drug produced through recombinant DNA technology and among the first genetically engineered products to be available to customers.
Okay.
Then sources of drugs.
See. Iguchala for Kawana of Yana. Of Yaneba. Kawana, what do you understand by what you just read now? That's what you want to hear.
This recombinant drug source is meant for DNA
What? Which drug? Example of drug from recombinant DNA technology. Example of such drug are what and what? You don't know. Continue.
So it's not for like to give the DNA those people that have DNA.
DNA what? Continue. To do what again? Just be talking. Just be doing your thing. Just be talking.
Okay.
Let me distract you.
Drug is any chemical substances that affect the physiological stage of an individual when taken. Example like acid ingredients. Example like paracetamol.
You're going back. Just keep the comment down on it. Leave that one. Just keep the comment down. Source of drug.
Source of drug.
Those that have not been discussed. You are still okay. The last one is what? Recombinant. Okay. Is that all you know about it? Then move down. Leave this one for now. Move down to this place. Those. You have 1 minute to go.
Dose is a measured quantity of medicine, nutrients, or pathogen which is delivered as a unit. The dose in a medicine is given the unit the dose you take so that the disease that's in your body will go quickly, but you won't take overdose to affect your body system. Then dosage form.
The time is up. Thank you. Thank you. Your time is counting. As a source of drug. You know what? You did you do source of drug? Oh yeah, tell us what you did on source of drug. How many source of drug did you do? Look at. Go and sit down. 0. Go and sit down. You are showing me downloaded work. Is that what I asked you to do? I think you download do all of your whatever. I think you do your assignment. It seems this class is not serious. I'm setting it now. The indication is rising, and I know how to handle serious people. Let us not keep wasting our time here. Start from there down. Imeria, tell us. Can you hear her? Please, you have to project your voice, okay, so they can hear you.
Union of pregnant women giving women full used for treatment of disability. Blood of animals is used in the production of vaccines.
What are you talking about? The recombinant DNA technology. Is that what you are talking about? I was specific on where you should start from.
Microbiology. Antibacterial living segments.
All right, thank you. Time is up. Sit down. Thank you. Thank you. Have you done? You've done, right? Good. Toucher. Have you done? Your number is what? Come on.
Recombinant DNA technology involves clearage of DNA by enzyme restriction and denucleation.
Is it clearage or cleavage? Check well. Key for them. Clear what? Clearage. That should be cleavage. It's cleavage, right? Thank you. Continue. Correct it. Continue.
Recombinant DNA technology involves cleavage of DNA by enzyme restriction.
Good.
The desired gene is coupled to rapidly replicating DNA, viral, bacteria, or plasmid. The new genetic combination is inserted into the bacteria culture, which allows production of vast amounts of genetic material.
Is that all?
Yes, that's the one I could understand what the direction is, because I don't understand.
Continue. Just continue. Just continue on with other things. Other stuff. If the sources are finished, you enter here.
Relevance of pharmacology.
No, leave this one. Just connect from here. Or you can think about it. If there's a working.
This is just simply talking about more like the importance of pharmacology in our field of medical laboratory. So we have like 10 relevance of pharmacology. We have number one as pharmacology studies how drugs affect biological systems. We have pharmacology, the study of how the body responds to drugs. Like pharmacology helps us to know how the body responds to drugs. Like when you take drugs in your body, how does it react? All those things that studied in pharmacology, like gives us like how the drugs react in our body. We have pharmacology integrates numerous other disciplines. Pharmacology exploits chemical properties of drugs. Pharmacology encompasses therapeutic effects of drugs. Pharmacology studies toxic effects of drugs. Pharmacology is essential for the improvement and development of drugs. Pharmacology studies are crucial for treating and preventing diseases. While pharmacology promotes the advancement of nanotechnology-based approaches. The nature of pharmacology offers scientific and broad range of research opportunities. All these are just trying to tell us how important, like what are the importance of pharmacology in our own system? What are those things that you need to know as a med lab? Like what are those things that you think pharmacology can give to you?
Thank you. Time is up. Thank you. Let me give you an expo. If you want to check up something online, on Google, if you want to get a material that will be reasonable for you, that gives you what you're looking for. Maybe you want to check phases of medicine now, or the difference between drugs and medicine. After that, put towards the end PDF. Am I communicating? Put towards the end what? PDF. You see different PDF files. Some may even be published work. Look for the one that look for the one that will give you exactly what you're looking for. Download as many as you can. Then go through them. Try to study them to understand them. When you are done, you can now pick out the points you need from them and make up your points. Simple. Am I communicating? And you can even do references of the source where you got it, so that for tomorrow you may want to get something again from that material again. You can easily look at the difference you made in your own notes. It can help you to go back to it in case the one you downloaded get what lost or clear from your what phone. Am I communicating? Most of the junks you see on Google, so that you see different junks. If you want to get some work that will help, just focus on what PDF. So some of them may even be published articles in different journals. But the main thing, just get as many as you can, but depending on what you're looking for. Then sit down, try to synthesize something out from it. Read it, understand it, then try to synthesize something out from it. That is the best way to go about all these things. Okay? All right. Have you done? Okay, you have done. Have you? Okay, sorry, I've passed this line. Have you? Come. Fast. Do it. Don't just do anyhow and come. Do it. If you don't know, just come and let's hear what you are saying. Yes, you will surprise that what I look out for is your confidence in talking that nonsense. You think it. That confidence, because you are operating at your own level. Understand me? And I don't expect you to rap like me or speak like no. What I'm looking for is that I gave assignments, you went, did it, came out with confidence, and you are taking it. You may be surprised that we may laugh for last things. I'll give you high score because of the confidence in talking that your nonsense. Because you are speaking at your own what? At your own level. It's not that you didn't, because you don't understand it, you give up and start looking for who to copy. That's the worst case. That is the worst thing that can ever happen to you. Are you aware that there's a place you go, save, and with confidence you talk nonsense, they'll clap for you, go. Are you aware? Are you aware? There's a place you may go with confidence, you are talking nonsense, and they clap for you. So please, try to do what you have to do. All right. Okay. Let's go down so that we can always come back. Go to this place. Go to. Okay. Tell us what you did on relevance of pharmacology. This is I said relevance of pharmacology in not generally. In what your area of study. That's what I want to hear. All right. Keep it on. What do you say? Project your voice. Speak to class.
Good morning.
Come out to the top. The voice will disappear. Boom. Why? Oh, yeah.
Relevance of pharmacology. Means the importance of pharmacology as the pharmacology in our field. Pharmacology is essential for the improvement and the movement of the drug. Pharmacological studies are fundamental to improving already existing medicine, designing new drugs by studying the relationship between drugs and biological systems. For instance, saying as in pharmacology help us to know as in the improvement of already existing medicine in our field.
Thank you. Go there. Start from those. Fast. Start from those.
A dose is a major quantity of medicine, nutrient, or pathogen which is delivered as a unit. The greater the quantity delivered, larger the dose. Doses are most commonly measured for compounds of medicine. A drug dose is a specific amount or weight of medication. The dose is the amount of drug taken at any time. Dose is the quantity of medicine. As in, quantity of medicine taken. For instance, when you're not feeling fine, you go to hospital or pharmacy, they will give you medicine, and they will tell you the dose, like the quantity of the medicine are meant to take. But if like you have they refer to side effects for the medicine. So there is a dose that is meant for you to take. Dosage form are also called unit doses.
Thank you. Thank you. Your time is up. Thank you. Your number is what? Have you presented? Come out also fast. Fast. Start from dosage form.
Dosage form, also called unit dose, are pharmaceutical drug products in the form in which they are marketed.
Pharmaceutical drug what? Product. Remember what I told you about medicine? That if it's called medicine or what? Drug product or what? Dosage. Remember? Right? Continue.
In which they are marketed for use with a specific mixture of active ingredients and inactive components in a particular configuration, such as capsule, shell, for example, an option into a particular dose.
Wait, are you listening to her? Some people are busy doing what I don't know. Are you listening to her at all? See, don't focus. Don't. If there's a place the person what he's saying differ from what you did, and you think that point that there's a point there, you put it down. Please listen. Continue.
For example, two products may both be amoxicillin, but one is 500 mg capsule and another is 250 mg chewable tablet. The term dosage form can also sometimes refer only to the pharmaceutical formulation of a drug product constituent drug substance, and any belief involved without considering matters beyond that, like how it is ultimately configured as a consumable product such as a capsule, patch, etc.
You want me to tell us what you have done in summary? Tell us what you understood by this dosage form you have just read now, because news can't go and get that. Tell us what you understood.
The dosage form is a form of like packaging a drug, either in capsule or in tablet. Like two drugs might cure the same thing, but they have different milligrams. And like let's say for example, one medicine, you can
can chew it.
But why so you can drink?
Yes, you can choose some, you can drink some. Even though they are the same, maybe albendazole, but they are two different dosage forms. Even though they still contain the same albendazole, the same active ingredient, but they are two different dosage forms. You can choose some. You can just swallow some. You can even inject some. So, albendazole you don't inject. I'm talking about other drugs. You can chew albendazole. You can even swallow. There's albendazole in suspension form. These things are different dosage forms. So if you are asking for talk about tablet, suspension, syrup, injection, these are dosage forms. Am I communicating? There's a diclofenac you can rub on your skin, true of course, for pain. Yes, the diclofenac you can rub on your skin for pain. There's one you can drink as a tablet. There's also that diclofenac as an injection. These are three different and suppository. These are 4 different doses of the same drug. Thank you. She did this work as if she's like a pharmacist. I like her work on this one. Makes sense.
Thank you, sir.
So if your work is lacking in dosage form, contact her. Pick points from what she did. Yes, I like what she did in dosage form. 757. I start from side effects. Start from side effects. Good morning.
Side effect. Side effect is an effect of a drug or other type of treatment that is in addition or beyond its desire or beyond.
Can you hear her? Can you hear her? Please project. See, this can belong to you. You can be bold and just be going around, be talking. I'm following you, no problem. It's your own. The 3 minutes is your own. You can communicate with your classmates. Be free and be confident. I'll just be following you up and down with my mic. And I continue.
Side effects can be harmful or beneficial, and most go away on their own over time. Side effects happen when a treatment causes a problem because it does more than the target issue. The impact can range from minor to severe and life-threatening. This place.
So it was.
Side effects can be explained as it is, for example, after taking drugs or medicine, there are some effects that can be harmful to the body and some can be beneficial. For example, marijuana has a harmful effect in the body, while adverse effect is an undesirable effect of a drug or other type of treatment, such as surgery. These effects can range from mild to severe and can be a life-threatening. It can also be called adverse reaction. Some adverse reactions can be predicted, while some occurs unexpected once many people take the medicine. Example, severe allergy. These adverse effects, the effects can range from mild to severe. For example,
it's okay now. 1 minute. What is the difference between side effects and adverse effects? In 1 minute.
Side effects. Some side effects can be harmful, and some can be beneficial, and some side effects can range from minor, from severe, from minor.
Thank you. Your number is what? 7 what? Okay, you've done, right? Kadeba. Have you presented? We'll talk about it. Okay? I'll talk about it.
Drugs, that's the component of DNA, so in sources of drugs, like it's not emphasized.
I'll still discuss all these things. I'll still discuss them. Am I communicating? I want to close the first round before. I want to close the first round. I'll discuss them. If your question has to do with what you hear, I'll talk about them. Unless you have something else to talk about. Maybe what I'm not talking about, you cannot ask a question. Is it okay like that? Good. All right.
Good day, sir. Good day, my fellow students.
Good day. It's not a good day.
Good morning, my fellow students.
So start from indication.
Indication. An indication is a valid reason to use a certain test, medication, procedure, or
Can you hear?
or surgery.
Because it's an indication, Megan.
Is a valid reason to use a certain test, medication, procedure, or surgery.
You say test.
Yes.
Test, right? Med lab, test, right? Continue. Okay.
The primary role of this section of labeling is to enable healthcare practitioners to readily identify appropriate therapy for patients by clearly communicating the drug approved indication. The indication and usage section states the disease or condition or symptom thereof for which the drug is approved, as well as whether the drug is indication for the treatment, prevention, relief, or diagnosis of that disease.
You go. Come on, you go on. Explain what you read. I don't understand what you read. Just explain it. Do it now. I'm focused on is what they're telling us, not what they're reading. So from this thing you read now, what is you understand by indication? That's the question now. From what you have read now, what do you now understand by the word indication? As regards pharmacology and drugs, what comes to your mind anytime indication is mentioned? That's the question. I'm trying to teach people how to. Some of you, anyway, it happens. It's yet to understand how to study. Am I communicating? Yes. There's a point in everything you need to do. Here now, she has been reading all these things, right, for the past 2 minutes, right? Now the question now is, what is now what? Indication. That you have to study. You can get the material and read, fine. After reading, what can you make out of it? That's the point. And that's what I want you to learn. So what did you make out of from this thing you read now? In just a simple sentence. I have covered everything. True of us. So give me that sentence.
Well, I think indication is a reason for identifying tests.
On a gray hair there. Okay, I'm here. I think, can you hear what is the indication? What I'm doing is beyond what? Pharmacology. If you understand where I'm going to and follow me, you will not regret attending my class. I'm going beyond pharmacology. I teach life in all my courses. So just try to follow and try to understand, try to join, follow up. What do you now make out from what you have read now? Indication. Actually, what is indication of a drug? What does it mean? Good morning.
I think it's the reason for identifying a certain test.
Your back is about to fly. Your skull is about to fly. It's flying now. It's developing wings to fly. And I don't want it to happen. That's why I'm giving you time. If I cut somewhere now near your bonus, or each of now 10. Read that thing again from here.
An indication is a valid reason to use a certain text medication, procedure, or surgery. The primary role of this section of labeling is to enable healthcare practitioners to readily identify appropriate therapies for patients by clearly communicating the drug approved indication. The indication and usage section states the disease or condition or symptom thereof for which the drug is approved.
Becoming down, okay?
As well as whether the drug
becoming down.
Indication for the treatment, prevention, disease, or diagnosis of that.
Is that all you can say? All right, thank you. Clap for her. Thank you. Thank you. What's the number again? 75 what? Madam, have you presented? Come on, fast, come on. Fast. Start from indication. Please the class, tell us what you did on indication and what you understand by the word indication. Fast. See. I'll tell you where to start from. Face the class and tell us. Fast. Your time is going. She said she didn't copy it in her note. I don't understand. Yeah? I say, give me, but you did you research on indication? Tell us what you got from the research now on the word indication. That's what I want to hear. Good day. Mm-hmm. It's not good day. Good morning. I am face the class. Zero. Go and sit down. Zero. Go and sit down. You're not serious. Your number is what? 7 what? Go and sit down. Zero. I hate you. I hate that with passion. Now phone. It's annoying. It irritates me. I give zero tolerance to that nonsense. Okay, you are done, right? Have you done your own? Okay, I think she has. You? No. You? Have you? Come, fast. If you have other.
Antagonism is more like there are some drugs that counteract more like the effect of I think that doesn't do what it's supposed to do in the body. So, there are some drugs that when you use does not truly give you what you want. So those drugs are referred to as antagonists, meaning that instead of them to help you cure some sicknesses or some illnesses or diseases, they more like give you an adverse effect. Like antagonism leads to adverse effect, which is more like
Tell us what you know about contraindication.
When you say something is contra, it means something is the opposite of something. So contraindication means the way not to use some drugs. When you buy some drugs, the leaflets that are there, they will surely write the indications and contraindications.
Okay.
The indications is how to use the drugs.
How?
Is what the drugs are being used for.
Good.
Why the contraindication
it's not what, as in, it's the opposite of indication. What the drug doesn't use, what it's not supposed to, like in the way you're not supposed to use it, or the opposite of that.
So what's that opposite?
Okay, a drug is indicated to cure, as in, when you buy, for example, gentamicin, in the indication that they are trying to tell you how to use it and what it's composed of, like the steps in which you are to follow.
Thank you. What's the number? Good. Next person. Have you done? Oga? Come on. Fast. Have you done? You've not. So only you are remaining, right? Only you, right? Who else? And you. Oh, yeah. So tell us about antagonism.
Antagonism can be defined as.
Can you hear him?
Can be defined as the process by which drugs act in the body.
The time is going up, you know.
Antagonism can be defined as the process or act by which drugs react.
I'm listening now. You have 1 minute to go, so continue. Thank you. Guys, sit down. Thank you. Your number is what again? 7 what? 7 what? 7 6. The person that did before you, okay, you are 7 what? 7 3 5. Okay, and you are what? 7 6 3. Okay. Next person, Kedia. Madam, fast, so I can conclude this and go. Fast. Good morning. Tell us about antagonism, fast.
Antagonism is a mechanism of drugs.
For what?
Okay.
Your phone for what? Are you okay?
Okay, antagonism is a way by which drug access to receptors by natural ligands and other drugs start activating the receptor. It means taking in as thereby a drug to block from certain parts. Or let me say
Pause. Are you aware?
I don't understand that antagonism.
So what did you browse? Let me hear what you browse. You have 1 minute to go. Tell me what you browse. See, in your notes, what did you put down? Not what your phone.
Sir, I don't know.
Go and sit down. What's the number? What is your number? Go and sit down. What's the number? 7 getting. What is your number? 7 what? Go and sit down. Next person. Fast. All right, tell us what you did on antagonism. Let's hear you.
Good morning, sir.
Good morning.
Antagonism is the reaction between two or more drugs
Okay.
that have opposite effects.
What's your number? Go and sit down. 7 what? Go and sit down, please. Go and sit down. See, listen. Hello? You have logo alcohol. Hit the point, bam. Zoike. I think it's just 2 drugs that have opposite effects. In Canada and Qatar. It will allow you to work. Simple. You don't have to go metabolism. See, I don't know. I don't know what is wrong. Antagonism. Now let me just run through this so we can end for it. Now listen carefully. I really dwell so much on this in our last class, 3 of us, trying to explain to you the difference between two. I told that all drugs, all medicines are what, but not all drugs are what? Medicine. Even though there are sometimes that's what is called placebo. Sometimes that's what is called placebo or placebo. So call it placebo. Sometimes that's what is called what? Placebo. Like now, they used to play some psychological games on some patients. There are patients that will come. There are sometimes the patient may come to a doctor complaining one thing or the other. Maybe the person's problem is psychological, and the person has been assessed and noticed that there is nothing wrong with what this person, but he needs to be assured that you are giving what drug. Am I communicating? Now, instead of allowing the person, because if the person comes to the doctor after a long story, the person will still go back and still going to maybe chemist to go and miss drug. Instead of allowing the person to go to chemist and they will miss junks and give the person to be taken, the person may be given placebo to make him believe that he has been given drug. It can be water. Placebo can be water, ordinary water, and call it something. Take it 2 times a day. The essence is to clear the psychological issue that person is having, that I have been given drug. Am I communicating? Even though it's not what people do, an official thing, but it's just that there are sometimes you use the number 6. You know that this person is okay call from morning to night. The person will not believe that you will not be okay until he takes something. And if you leave that patient or what's minimally in them, outside, without, because you know there's nothing wrong with this person. You just need maybe rest, maybe some psychological reason you need to rest and get yourself. Even on your media, but I say, hi, hey. No, look at. I'm not committing. So in that case now, you can say it's medicine in quotes. I'm not committing because it takes care of that psychological issue, but at the same time, it's not. It doesn't contain what any particular what drug. I'm not committing. But that one is just it's not an official thing. This is what people do in the field out of their own creativity. I'm not communicating. For that, what I give person is not a harmful thing. So maybe just package anything. So maybe just package something. No, they make on. You'll be okay. No, what they make on wire. On which I feel on go down. Oh, well, not to play. I don't know what they make call. I don't know make. If you're okay, they're happy. If you're okay, be happy. It's psychological. People do all those things in their practice out of their own creativity. We call all those things what? Placebo. That's what I was giving. That there's no drug inside, just to take care of something. Yeah. But apart from that, drugs, all medicines are what? Drugs. But not all drugs are what? Medicine. Am I communicating? I'll be talking about that. Then, of course, we say that the drugs are two-edged, like sort of two-edged sword. That if you're not careful, drugs are subject for abuse, but this one is not subject for what? Abuse. Even though some human beings still abuse medicine. I think I told you about how people will come to chemists because it's codeine they're looking for. They'll come and buy Benelin plus codeine, like 10 bottles. Up one lot, go very high. His Royal Highness. Are you with me? Even though yes, it's not officially, some people still go their extra mile to abuse it. But this is more abuse because as you are using that, as they are injecting it in their system, as they are inhaling it, they don't even know the milligram they are doing. They may take, every drug, like what is called therapeutic dose. We have therapeutic dose. Therapeutic dose are the amount that can take care of the particular disease you want to treat. We have sub-therapeutic dose. Sub-therapeutic dose are below the dose that you can't cure what you are treating. We have leather dose or toxic dose. A dose that is very high that can be toxic in the system. The same paracetamol you are using, I think I mentioned in this class, can destroy your liver, depending on the quantity you are doing taking. Am I communicating? So you have gone above the therapeutic dose. You have gone to what? Toxic dose or leather toxic dose, leather dose. Leather means death, right? Letter. Are you aware? Leather. L-E-C-H anything that is leather is killing. Am I communicating? Good. Now, between this leather dose and the therapeutic dose, we call it therapeutic window or therapeutic index. Remember I told you we have sub-therapeutic dose, right? We have therapeutic dose. Then we have, either I call it leather or toxic. Toxic is that it has not started killing, but leather is that the person is on. Now, between this leather or toxic dose and the therapeutic dose is what is called therapeutic window. Am I communicating? Therapeutic index. You call it therapeutic window or therapeutic index. Some drugs have a very small therapeutic index. So what is it that a drug has a very small therapeutic index? What does it mean? It means that the small, if you abuse that drug, you can offshoot and go to the leather or toxic dose. So you should be careful about the quantity you are doing using. But as some drugs that have a very wide therapeutic window, even if you take like paracetamol has a wider, even though 10 tablets can be harmful, one can still take 3 and when they get more, I'm not convinced. But there's some drugs like digoxin and most of these hard drugs, very narrow therapeutic window that if you abuse it, it can scatter the person's. Of course, where they normally go is psychological. If one has when Burmese started now, you see what it destroyed a lot of our youth, and today they have not recovered. You wouldn't understand. Go to psychiatric hospital. You understand what I'm talking about. You see our youth there. Most don't know the effect of that thing. They were just using it anyhow. They don't even know the milligram that they're supposed to use. They're just using it anyhow. They're just, of course, one is that about the milligram you are supposed to use. They don't even do it. Secondly, what are they using it for? Anyhow, they just be abusing the drug. It's very, very dangerous. I'm not communicating. So this is prone to what? Abuse. Unlike this one. Am I communicating? Drugs, medicine can be drugs, But drugs can never be what? Medicine. Am I communicating? Medicine can be drug, but drug can never be, because medicine contains drug. Am I communicating? But drug can only be medicine when you use it and add other ingredients to prepare what? Medicine. Am I communicating? So on your own, you can dish out different points. Am I communicating? There. So that one, I believe you should. Then sorts of drugs. Someone came here. I think he was one that listed about 6. Wonderful. Now, when you talk about sorts of drugs, you also think of, it came from the fact that we also have different drugs. We have. Let me now have 3 major categories. We have natural drug. We have natural. We have what? Natural. We have what? Synthetic. Am I communicating? And we have what? Semi what? So plants, animal fall into here. Plants, animal, they fall into where? They fall in here. Am I communicating? Am I communicating? Then synthetic. This one is mainly maybe they discovered, maybe let's assume now that a plant, if they will extract a drug product, an extract, or a secondary metabolite, secondary metabolite from a plant, they carry it and they test it pharmacologically, maybe in animal. Maybe they are claiming before that our forefather, our great native doctor in our village used to use this one to treat what? Malaria, for example, now, or headache, or pain. They will now extract, those in pharmacology will extract the what? The metabolite, maybe it's the leaf that they were using. They will soak it, use alcohol or whatever to extract the content, right? Then after they will carry out some preclinical tests using animals, and they may inflict pain or maybe pain or ulcer, depending on the type of what the plant is treating in animal, and use it and administer those extracts in that animal. If it takes care of that particular, if it clears that ulcer or clear the inflammation, it will tell them that this is actually true. They will now start. They may also use it because they have been using that plant to treat the disease before. They may even go straight to use it on human beings because they have believed that since they have been using it and nobody died. But to be in safe side, they will start from what? Animal. Because sometimes all those things may be causing death. They don't even know. Because they are all they know is that they treated it. Maybe maybe they may even be attacking the liver. We can use treat malaria for like tata. Maybe in about 2 years, they forget that they use it to treat malaria. It may cause effect in the system, but they won't know. Maybe after like 2 years, they won't know what killed the person. Am I communicating? To avoid such things, they may start from what? Animal. They watch other effects on the animal. They will, when they will kill the animal, take different organs in the animal to show that there's no other place it has negative what? Effect. If it indicates that it can take care of this particular disease, they will now come up a bit and do what is called structural elucidation, or they may want to focus on the natural source first, get it to animal and plant and clinical level. When they are done and certified that this thing can actually take care of this effect, they will now do what is called structural elucidation. That particular extract from that plant, they will go to, that is where chemistry will now come in. Remember, it's started with what? Pharmacology, pharmaceutical chemistry, pharmaceutical and medicinal chemistry. That's where they will now come up to try to do what is called structural elucidation, to take the actual, what is the component of this, because chemistry is life. Everything in this life has chemicals, has elements, atoms, elements in them. There's nothing that exists without chemicals. It's not possible. Even you as a human being, you are filled with elements. True of us. From hair to your what? Toe. Your hair is filled with different elements. Everything, even the clothes you are wearing. Now, they will try to find out the structure of that particular extract that is actually responsible for this what activity. Now, when they discover that through structural elucidation, they will try to synthesize it. That is what people in drug production do, not drug manufacture. Drug production, those that produce paracetamol you import to prepare paracetamol what tablet. They already have a structure of paracetamol. They will synthesize it from lab to industrial scale. So they will not try to synthesize that what particular extract, because they believe that if we start using this plant source, it may not be enough to take care of large population. True of us. They will try to synthesize it. When they synthesize it, they also the molecule they synthesize, they also test it again, carry out the same test again to be sure that it's doing what is the same thing it's doing when it's in that extract. I'm not getting this. Any drug you get from this synthesizing the original compound that has such effect is called what? Synthetic what? Synthetic what? Method. Am I communicating? You just know the structure and produce and synthesize it through chemical what reaction. We call that one synthetic what? Source. Am I communicating? Then we have semi-synthetic. Someone read here that semi-synthetic, that the natural drugs still maintain their core, their main, but they just change one or two groups on the what? Structure. Maybe they added methyl group. Maybe they added methyl group on the structure, or they removed methyl group, added hydroxy group, or amino group. Am I communicating? To check whether it will have an improved what effect. When they do any drug from this method is called semi-synthetic. It still contains the natural one, but they just change one or two structure, one or two substrate on the structure to produce another one that may have an improved activity. That one is called what? Semi-synthetic what? Source. Am I communicating? Now, but then also when it comes to this, I want to talk about recombinant DNA what? Technology. Now, from animals, have you heard of genetically modified food? There are some food. Are you aware that through biotechnology, even though they don't advocate for that, they prefer natural food? But are you aware that you can genetically engineer food, even yam, genetically get through the DNA. You didn't cultivate anything in the farm, in the lab. You generate yam. It's possible. Yeah. It's not normal process of getting yam. Go to this and plant it. Am I communicating? Now, this takes us on that thing now. Okay, just know, the important thing I want you to know is this. There's someone talk about cleavage of what? DNA segment. Am I communicating? Everything, every characteristic displayed by any living organism, be it human being, be it plant, is encoded in the what? In the gene. And what is gene? What is the difference between? What is the relationship between gene and DNA? Who can tell us? Gene and DNA.
Gene is encoded in DNA.
Oh yeah? Who will tell us? Relationship between gene and DNA. Is it the gene that is inside the molecule, the DNA, or DNA inside gene? Which one? DNA is inside gene, or gene inside the DNA? Some people said that the gene is inside DNA. Some say that DNA is inside gene. Confusion everywhere. Huh? Who can define gene for us? A gene for us. Who can define a gene for us? Huh? I know. Uh-huh. Is it DNA that is a segment of the gene, or gene is a segment of DNA? Gene is a segment of what? DNA. Okay, gene is a segment of DNA. Overall DNA is a segment of gene. I like this class. It's becoming stressful. Huh? Okay. Did it contain gene? It contain gene, Okay. Okay, DNA is inside gene. Okay, gene is a segment of DNA. Huh? DNA. I like this. Now, let's continue. Now, everything that has to do is a segment of DNA, right? Everything that has to do. That's why, if you give birth and your child will look like you. Am I communicating? Because there is everything that has to do with your appearance, apart from the behavior that may be some element of in behavior and genetic and environmental interplay anyway, because the way what you are exposed to can affect the way you behave. But again, some element of that genetic there. Then depending on where you are, that's why twins that 2 to 8 to 2, even if it's identical twins, you separate them. Blue of the USA, blue of Nigeria. After 20 years, again, their mindset will not be the same again. True of us, even though that if you go genetically, they will say have the same show that they have some genetic link, but their mindset, their value, and everything will not be what? The same. And your value affects your behavior. True of us. What you value behavior affects your what? Behavior. So that one is what? The difference. Now the point I'm making is that the DNA, a segment of it will what? Cleaved. We call it what? Cleavage. Now, let me use this. Have you heard of insulin? Have you heard of insulin? Yes. Vaccine? Yes, of course you should now. Vaccine. Let me use insulin. Now, what happens is this. In recombinant DNA technology, what happens is that there are some organisms, am I communicating, that they discover that have effects on, maybe because of how they regenerate, how they produce, am I communicating, how they duplicate, call it anything, replicate, like bacteria. Within few minutes they have good. Now, what happens is that they use pig, something like pig, mainly. Some part of the, what part of the human body that is responsible for production of insulin? What part of pancreas? The islet of what? Right? Good. Now this part of the pig will be what? Extracted. Now, they study that production of this insulin has a lot to do at the gene level. I'm not forgetting the part of segment of DNA coding that is responsible for it. This part is what they will now study and now try to inculcate it or try to implant it in these organisms, organisms that replicates. Now, when this is done, as they are multiplying, they are duplicating whatever this gene responsible for this production of what? Insulin. So as the more they are doing, more of this is what produced, because the amount in this cannot be enough. How many pigs would they get and kill? How many pigs would you think you can get and do what? Kill, to be able to extract it to prepare what? Insulin. Am I communicating? How many of them? How many will you kill? We also have human insulin anyway. Am I communicating? But the point that what is behind this production is what? Recombinant what? DNA what? So they will integrate it into the genome of this organism. So as they are multiplying, they are also multiplying. The quantity is also what? Increase. After that, they will now extract this. And that's why today you keep seeing large production of what? Insulin. It also, there are different other drugs that you can genetically what? Engineer using what? Recombinant what? DNA. In this other thing, would you call this, where do you think this should be? Is it natural or synthetic or semi-synthetic? Synthetic. Synthetic. How? Huh? Thank you. It's separate. Am I communicating? Biotechnological what? Method. Am I communicating? That's where it should be. Because it cannot fully align to this place. And it cannot fully align to what? This place. This is different. Biotechnological what? Means. So here you have 1, 2, 3, 1, 2. Then animal and mineral too. Mineral is also what? Natural. Am I communicating? That is someone mentioned. You mentioned what again? What example did you mention? No, I mean mineral. Example of drugs from mineral salts. Kaolin is there. True or false? Kaolin is also there. Then what again? Vitamin what? Vitamins, they are all what? Vitamin minerals. Are they minerals? Zinc, good. Those are giving zinc supplements. True or false? Zinc supplement for the diarrhea, right? For patients that have what? The diarrhea. Selenium for those that have fertility problem, right? Calcium. All those things fall here. When you now you start having macro and micro. I'm not true or false? But all this is under what? Natural. So we have 1, 2, 3, 4, 5, 6. Is it clear? Microbia, salt, all of them are under what? Bio what? Technology. True or false? So we have 1, 2, 3, 4, 5 what? 6. The number of the 6 stocks. There are some material you will see. They will just break it into 6. I just group it for you to understand it. Natural, we have plants, animal, and what? Mineral. Synthetic is there on its own. Then we have what? Semi-synthetic. Then we have what? Biotechnology means. Am I communicating? These things are sources of what? Drugs. Now, without wasting time, we have. I said that. I mentioned one or two things here before. Of course, now I told you something about your culture and sensitivity test, right? Your knowledge of pharmacology will help you to actually be able to understand the sensitivity. True of us, because if you don't know these drugs, what they are, if you don't know anything about drugs, you just be like a robot that is just carrying sensitivity without even knowing. Sometimes, if there's a mistake, sometimes there will be a mistake in what you are, maybe the name of drug you are dealing with. But if you don't know anything about drug, you just write it that it's not true. It's like if you are working where you, even though they are typing it, even though I don't think it, I think it is from what I've, even though I'm not a medical lab scientist, but from what I've learned, I prefer handwritten reports to what? Typed one. True or false? True or false? Is it true? Is it true that that's what they prefer to type one? True or false? Amaro? I think I got such information in the past. I don't know whether they've changed it now anyway. Huh? No, as I think in the practice, I say I don't know whether it's true. I don't know whether it's true because I'm not in the field. You know, you interact with different. It's a healthcare team. But the information I got about lab results is that the one that is by practice, ethically, the one that is preferred to report. After I go the figures with the results you got to get and type or type. I know me in the past, but I don't know whether it's true or not. Now, maybe I don't know, but I learned the one that is that the practice prefer more is the what in one than typed one. Yes, you get the report sheet, but you use your hand to do what? Write it than typing it. Oh yeah, no, man, I'm not amazed. You find out. I push it to you, find it out. And if you don't have question, okay, maybe in our next class you tell me, okay? Okay, good. That's how you learn. You keep learning. Now, of course, let's assume that you don't know anything about amoxicillin. You don't know anything about it. If there's a mistake maybe in the disk or whatever, you cannot correct two of us because you don't know what it is. So that's why this knowledge of medicine will help you in your reporting in your sensitivity test. I'm not competing. Sometimes I think kind of unknown plus. This is the what? How susceptible this particular microorganism is to the what? Particular what? Antibiotic to two of us. So on plus a man or the highly susceptible. That means if a doctor uses this drug to treat the patient, it will get a more positive what? Effect. True of us, you can take care of it more. Now this one may be prone to what? Resistance. True of us. There are some that which you see are true of us. Good. So before you know, you'll be able to interpret or even report properly. You should know these drugs. Don't you think so? You should know these drugs. You may not know it as deep as, but at least, especially in the area of antibiotics, antibacterial, antifungal. Name them. You should know them at the tips of your finger. Am I communicating? So this is also one of the words, the relevance of pharmacology in your area. None of you talked about it. That's why I kept it, but I want you to research more on that. Am I communicating? Those that came up with me are just giving me generally relevance of what pharmacology on a general note. I'm not. I want you to do more work on that. We'll talk about it later. Then in our class, I also made mention of situation whereby maybe in drug monitoring. Drug therapeutic monitoring. That's area of pharmacy we call drug therapeutic what? Monitoring. Monitoring the effects of drug. When they want to get results, maybe as a pharmacist or a doctor, a pharmacist mainly, that one is purely pharmaceutical. You want to monitor the drug in the serum, appearance in the serum, or even bioavailability. He's a medical lab scientist that will carry out the sample. It's not true, and go and test the content of the blood by the direction given. Even in this part of the country, I don't think it's common here. It's common outside the country. I'm not communicating. If you work, especially in the hospital setting, the work in the medical lab is over there. That's what they do in their chemistry unit, 2 of us. So now, if you don't know much about this drug, you won't be able to. Even though yes, you're not the one interpreting, but at least you should. Even about drug, any issue you can correct it. 2 of us. Any mistake, even in spelling, you can do what? Correct it. So this was also another important area. I want you to do more because I'm not satisfied with what you do. The more you do, the more I come out with more points. That's when you will appreciate what you are doing. Am I communicating? Now, without wasting time, pharmacological term, dose. What is the dose? Those that came out here, I'm not satisfied with the definition they gave. Dose of a drug is the amount of the drug that, when administered or taken by a patient, when you hear administered, it means that the drug is being administered. But when taken or given, even at the patient take the drug. When you say apply, the patient is applying it on the body. Watch this 3 times. Anyway, administered is general anyway. Administered is what? General. But when it comes to administration, we have taken, means that given, apply. Is it clear? All of them is what? Under what? Administration. But if you hear taken, means that the person is. If you hear given, if you hear apply, is it clear? Good. Now, when taken, given, or apply, achieve a particular therapeutic what? Outcome. That is a what? A dose of it. So a dose of a drug is that amount of drug that when given, taken, or applied, or you can simply say when administered, achieve a particular therapeutic what? Outcome. At what? Achieve. Let's assume that your therapeutic purpose of taking the drug is to take care of your headache, right? So the amount of paracetamol at a time, at a particular point in time, you can take, it gives you a particular. At least if you take 2 tablets of paracetamol now, I can wait some relief, 2 of us, to achieve a particular therapeutic effect is the dose of what? The tablet. Now the dose depends on different things. Can depend on the age of the patient. It can also depend on the weight of the what? Patient. Body surface what? Area. That one is, I don't want to go deep there, but just know that it's the amount of drug that can achieve a particular therapeutic what? Outcome. Depending on the outcome, the what you want to achieve. Now that is the dose. It can be mainly milligram, especially the solid one. The liquid one, you start seeing milligram per so mil. Am I communicating? Maybe milligram per so mil. And I think we would discuss that. Then, where is that lady that dismantled dosage form for us? I like the worksheet. The Kebon or Pugo? Where is she? Yes. I'm calling her Miss Dosage Form now, from now onwards. That's our Miss Dosage Form. I like the work she did there. That work is highly pharmaceutical. That work is highly pharmaceutical. Now, dosage form, I think I told it before now that you either call it dosage form, drug products, or medicine. Am I communicating? So dosage form are those different forms in which a particular drug is prepared and the what? Presented. Am I communicating? Am I communicating? You can say formulated and presented. Now, there's that particular form that they prepare that particular drug in question is called a what? Dosage what? Form. A drug may have, one drug may be presented in different what? Dosage form. One drug may be presented in different, I mentioned paracetamol. Paracetamol is a drug. Paracetamol can be presented in different dosage forms. You can see paracetamol tablets. You can see paracetamol syrup. You can see it as suspension. You can see it as injection. Am I communicating? The same paracetamol. But why do they have the different dosage forms to achieve different purposes? It may be that they want the patient to be compliant. That's what you call compliance. Compliance is a patient taking the drug as directed. That's to say that the patient is complying. The patient, even taking the drug at all, is compliant. Am I communicating? Now, some patient like now, will you go and start giving a baby tablet to swallow? He cannot comply. True of us. I've not seen why they now say, okay, let's put this paracetamol in syrup form so that this baby can do what? Can take it. I'm not communicating. Now, somebody that is on any paracetamol or more, he will vomit it. And the person is on a high fever. Can you get me? Injection. I've not seen it now. For such patient, any injection to take out the what? Okay. If you give the patient tablet or syrup, you will vomit it. Am I communicating? Am I communicating? So these are the reasons why you have different dosage forms, to be able to ensure that the patient complies to what? The medication. So that's the meaning of what? Dosage what? Forms. Then side effects. Every drug, naturally, every drug as is treating this. Remember what we define as drug. The drug is that changes what physiological what. So as he's doing this, has other effect he's doing somewhere else in the body. We call it side effect. Am I communicating? We call it side effect. As he's treating headache, maybe do some other things on the other part of the system. It's called side effect. Those what extra one is doing from the intended reason for taking a drug. Any other effect a drug has in the system that differs from the intended is what? Side effect. But that side effect now, the problem that comes now, that side effect can be positive. You can even, there's a side effect you can utilize some drugs. Like now, there's some drugs like that this drug they call, even say, some patients say that even have BP, high BP, think that is a BP drug. Because you can go BP at all. Am I communicating? The drug is meant to calm you down, your nerves down, but onward effect. They now utilize that side effect to take care of 1 year alone. Is it clear now? It's actually a side effect, but it's positive now in this case. True of us. There are something like pyridine, chlorpheniramine has some side effect of making you. There are some company that produce tablets of paracetamol. They added pyridine there. Why they add it there? They add it for you to. They call it. They tell you to take it in the night so that you will sleep. Sleep in Ablo is not the reason why they produce what? No. But they are utilizing the side effect, which is positive in this case. Am I communicating? Now, that's why I said that side effect and positive. But when that side effect of that drug becomes very harmful, untold or wanted, it becomes a what? Adverse effect. Is it clear?
Yes.
It becomes adverse effects. There are some adverse effects that is drug oriented, drug related, but there are some that are patient oriented. We call it idiosyncrasies. There are some patients that react to a particular drug. It's an adverse event, but it's patient oriented. It's patient related because it's for the patient. It doesn't happen to every other patient. Am I communicating? But the point is that any effect of the drug that is harmful becomes adverse effect. It is still a side effect, but this one now is adverse. Am I communicating? So all side effects, all adverse effects are side, but not all side are adverse. Is it clear?
Yes.
But not all adverse effects is a side effect of a drug. But not all sides are adverse. But because they now curtail, make it simple. Instead of long story, they now take this one to see. They just and there are some books you see. They'll tell you that this one is positive, this one is negative. I'm not communicating. But in research, there are some of these that are negative. They contribute to this adverse effect. Is it clear?
Yes.
Is it clear? Good. I don't know if I answered that question. Good. Now, coming to indication. The person that came here, there's also someone that, even though he took her time to answer it, but in summary, she still came up with something that indication is the purpose or what you want the drug for. What the drug treats, simple. Once they see, what is indication of paracetamol? Headache, fever, pain, chicken, no long story. What that drug treats is the what? Indication. Simple. No long story. So if I say what is the indication of glucophage or metformin? Simple what? Diabetes. Chicken. No long story. Is it clear? Good. Contraindication. Some people came here and we are saying that contraindication, what do they even define? Oh, well, I'm talking about what they define, those that came here. They say that. Okay, somewhere now. When he said that, when you hear this drug is contraindicated in pregnancy, what it means is that you should not use it in what? Pregnant patients. So contraindication of a drug simply talks about the category of patients you should not use it on. That is simplest. So if you are asked what is contraindication of this drug, maybe a pregnant woman in so trimester, maybe the drug has untold, unwanted effects, adverse effects on such patients. The adverse effect is not what? Tolerable on such what? Patient. Maybe it will affect the baby. I think it's contraindicated in what? Pregnancy. Something like, I think that diclofenac is contraindicated in ulcer patients. Because for the mechanism of action of diclofenac, it makes the ulcer to be what? Worsen. Am I communicating? It worsens the what? Ulcer. It makes it to be worse. So it worsens the ulcer. So it's contraindicated in ulcer patients. I think now there are some drugs that is contraindicated in patients with diarrhea. Ogu kwesi ime mmadụ ka onye ọnụ spiritual ọkụ ya iji bụrụkwu ya nye onye nwere diarrhea gịnị ga-eme onye a onwe isi ọrịa nke a bụ nye ozi agawazi ọrịa. So such drug is contraindicated in such a patient. Is it clear? Am I communicating? Good. Now, antagonism. This young man that day scattered antagonism for us in a simple sentence. Antagonism is just a phenomenon whereby a drug counteract the effect of the other. It can attack it directly, or it can go and block the receptor where that one should bind. It can attack the drug directly. Am I communicating? It can as well go to the receptor where the drug should bind directly to work. It could go and block that receptor. The drug cannot bind again. It's also a form of what? Antagonism. But in summary, antagonism, a drug good. Two drugs are, the drug affect the work of, and this thing will also help you, those in pharmacy, the doctors that prescribe, to know two drugs you should not prescribe for a patient to use at the same time. Am I communicating? Am I communicating? Good. I want to hear from you before I talk about this thing, so you don't skip my class. In our next class, we start from where? From here. So please let us not forget. In our next class, we start from here. If you have any question, you ask. If you have any question, you ask. And please, you allow me to go before the end of the day. Maybe before I will get back to my office, I will drop our next assignment in the WhatsApp group. So if you're not in our WhatsApp group, please help yourself by indicating. We have gone. If you're not in our WhatsApp group, help yourself by doing what? Chat me up on WhatsApp. This is my number. Chat me on WhatsApp. This is my number. If you're not in that WhatsApp group, just chat me. Send me your full name. Your surname should be in capital letter. Then your reg number. Your full name, surname in capital letter, and your reg number. Chat me up and say so I can add you. No, aspirin is not for treatment of ulcer. Aspirin is for pain. But a patient that has ulcer should not use aspirin, because aspirin will make the ulcer to get worse. Am I communicating? That's why aspirin is contraindicated in ulcer patients. Is it clear? Good. Sometimes the drug will not work at all. Sometimes it may reduce the effect. Am I communicating? Sometimes the drug will not work at all, or the effect may be what? Reduced. Am I communicating? Just like taking maybe drugs that let's assume now you take antacid now. If you take antacid with other drugs, see what the antacid will do. It will go. Of course, antacid will reduce the HCl in the what? In the what? Stomach, right? Antacid will reduce the what? HCl in the stomach. For ulcer, it's not true. It's not true. And antacid is busy doing its work, trying to reduce the HCl in the stomach, so that the patient will be what? Relieved. True of us. Now, but if you use it together with another drug, what do you think? What effect do you think it will have on the drug? If the HCl in gastric juice is reduced, do you think that the drug can easily be disintegrated? Do you think? What helps in disintegration? All of the gastric juice, right? It's a form of what? Antagonist. That's what they tell you. Take it before. You don't take it with other drugs together. Give space so that the antacid would have worked and go its way before you take the drug. The same thing with food. If you take it with food, what do you think will happen? There will be constipation, because the HCl that helps in food digestion, true of us, does it help in the digestion? It's been attacked by antacid you took. So if you take antacid immediately and eat food, what will the effect do you think it will have on the food? Because the digestion will not go the way it should go. It's not true. It's not true. This has also happened to using the same drug with antacid together. Let me stop here before I go.
I think that this side effect was positive, because I googled it and they mentioned some negative effects, such as headache and so on, dizziness. So I don't understand how side effects and how that effect very well.
What is the point? Let me understand.
According to what I googled. say that the side effects, examples of side effects like headache. I was wondering how can you drink a drug and the side effects will be headache?
Yes, now headache. Sit down. Headache is a side effect. I'm not competing. Headache is a side effect. A side effect is anything the drug will do in your system apart from normal thing you wanted it to do. Always not thought you can have a system that causes a headache. It's a side cheek on your side cheek. Yeah, side, yeah, on your neck. The additional, on a something else apart from what you wanted to do. Side effect, side by the side. But sometimes this side effect can be exploited for your own what benefit. Like now, if you take Piriton in the afternoon, you don't want to sleep, right? Right? And the Enaga knows Olana Togi. It's a side effect. But at that point in time, or they are positive to you. Because it's making you not to do what? To work. Or yeah? Okay? But Ola a doctor, open his now wagi, and Ola and you want to sleep. A doctor now prescribe that medicine that contains paracetamol and the chlorpheniramine. Because of side effect of chlorpheniramine, you sleep well. You will not sleep well in the night. On opposite side effect, but it's positive for you at that point. But Aria, is it clear to you now? You needed it at that point in time. You need that sleep. That you want to sleep. When you go to Aria. That's the point. Yes. Cipro. You should not drive. Cipro. Kebefulia. What is it? What is it? Okay. Sorry, next week, yes. Please, that reminds, please, I want to streamline our lectures now. So we're meeting Tuesdays and what? Good, Thursdays. 18 o'clock, okay? So Tuesdays and Thursdays, 18 o'clock. All right. So next week Tuesday, let me see, okay? Then do more work on that on side effect / adverse effect of Cipro. Do it and report to us on Tuesday. Diagnosis. You are trying to find out what somebody is suffering. I'm not getting maybe through signs and symptoms and definitely through lab results. That one is the diagnosis. I'm not communicating. But there can be indication for a particular lab test you want to do. Two of us. But we want the indication for what is the indication for culture and sensitivity test? Okay. What is the indication for PCV? Are you okay now? Why you want to do that? What do you want to achieve? The reason for doing that thing. What will we find out? What do you want to find out in doing this test? Am I communicating? Are you okay now? Any other question? Hello, please, Suda. Please, though. In drama, in literature, we have antagonism there. We have your problem and God issue. With respect to what to but even at that antagonism is attack earlier. And you see, it's still talking about if we are antagonistic to each other. Bob will attack each other. If we are attack you. We are always, our opinions are always opposite to each other. You see, he said the same principle anyway. Am I completing? Any other question? Hey, you can go to Bigun. Ask.
Why is it that both of us might suffer from the same drug? So the drug might heal my own.
There are different factors that can contribute to that. There are different factors that can contribute to that. Even the way you may be putting her on under the bed. Is also a factor. Compliance is a factor too. Compliance is what? A factor. Maybe you are complying, she's not complying. It's possible. Am I communicating? That's number one. Now, even at there, especially drugs that are anti-infective drugs. Anti-infective drugs are drugs that take care of a particular disease that's caused by a particular organism. It's anti-infective. Antimalarials are anti-infective. Antibiotics are anti-infective. Antifungals are anti-infective. Am I communicating? Drugs for pain, they are not anti-infective, true of us. Now, so anti-infective, they have a particular organism they are dealing with. And you did your minimum inhibitory what? Concentration. Have you done something like that? MIC. Okay. Of some antibiotics in the blood stream. Now, MIC is the minimum concentration of the antibiotics in the bloodstream. He has to now go and pick loss 4 times every 6 hours. Is to maintain that MIC in the bloodstream that will be attacking the what? Microorganism. If you make a mistake of not taking it as at weight due, we can take it 4 times in wolf by 2. Check it is by 10 in carbon in one. You are not helping, you will develop resistance. That organism will develop resistance to that what? Drug. Even if you don't, some may not even take it today. Then after 2 weeks, they remember that they were taking drugs, they continue. You are not helping yourself, and you are not helping yourself and even the community where you are. Because that's what is called cross resistance. There's also what is called what? Cross what? Resistance. So it's possible that the person did not even take it as at when due. It can lead to that. Then we have idiosyncrasies, personal. We have, our genetic makeup are not the same thing. Maybe your system, maybe you are whatever metabolizes the drug very easily. I'm not forgetting. Or maybe you also have some underlying element that even maybe the drug maybe a what syrup or what tablet. Maybe the system you did your physiology, biology. Maybe the system he has issues with even absorption. Are you aware that if she has issues with absorption, I'm not forgetting. It may affect drug working in a system. True of us. It's not what the blood presented that we go and act. True of us. It may have some underlying element that even that jeopardizes what absorption. Or he may even took the drug with something else that even affect the drug. Oh, one neighbor asking one malaria. Haracho oluma. Mango, vitamin C attack, especially artemether lumefantrine. Vitamin C attack it critically. You don't have mercy with it. If you see any artemether group like artemether lumefantrine, you don't take vitamin C together with it. Have you now seen the reasons? There are many factors that can lead to that. So you may even respond faster than her in the drug. So anyway, a lot of things. It can be genetic factor. It can be the food you eat together with it. It can also be how you take the drug. I don't even answer that question. So it's possible. Very, very what? But the one that is common is how we take the drug. That's one that is common. How and when we take the drug. Any other question? Huh?
Antibiotics, they say don't, there are some drugs, anti-malaria, they don't take multivitamin. You take that one in that stage.
The same to what I'm saying now. I say vitamin C. Yes, vitamin C. Mainly the culprit is vitamin C. So, and as they are saying, don't take anything but vitamin. Anything vital, they say don't take. Macamolan can take. Okay. Then, if you're on maybe a fried food helps it to be absorbed well, better. I'm not getting. I think I'll stop here because we'll see next week Tuesday. I will drop. Please be checking as